Hi, I'm Olga Gross-Balzano with Berry Dunn's Healthcare Group. In this short video, my colleagues and I will talk about actionable items that every hospital, nursing facility, home health, or hospice agency need to know about working with Pepper.
Hi, I'm Rachel John Deere from the Home Health and Hospice Group. The Program for Evaluating Payment Patterns Electronic Report, or PEPR, summarizes provider-specific Medicare data statistics for services vulnerable for improper payments. This report is critical for any provider type and should be a part of the organization's compliance program, as it will help identify outliers for these risk areas. While PEPR was developed as a compliance tool, this data can help identify both potential overpayments as well as potential underpayments, an area for revenue cycle optimization.
Hi, I'm Denny Robert. I'm with Berry Dunn's Hospital Group, and I focus on revenue cycle across all organizations. We know PEPR is certainly not new, but there's been some changes that we'd like to make you aware of today. First, the PEPR reports have changed from being pushed to you to now that they need to be pulled. You may be used to getting your PEPR reports by mail, but now you need to retrieve them yourself and to get your report, you need access to their secure portal. If your organization has experienced recent turnover, you may not have an administrator or someone that can pull these reports for you. Number two, you want to be aware that these reports are now downloadable and available to you, but we've heard that there's been low download rates. So that means a lot of organizations are not getting this critical information, and they're not aware of where they are compared to their peers. And again, this is really important information, and we hope that you folks download your reports and use this information, because the third thing we want you to know is PEPR is a critical compliance report, and it's really important to understanding how your revenue cycle is doing compared to other organizations. So again, we hope that you folks download these reports and use it to improve the performance of your organization.
Hi, I'm Cheryl Gregory with Berry Dunn's Compliance Group. On our website, you'll find provider type specific checklists for actionable items. In general, we recommend that any organization consider at a minimum the following steps. One is obtain PEPR portal access, as it's only available to a limited leadership position. Number two, schedule report download. Know your organization type distribution schedule annually for all provider types except for short-term acute care hospitals, because their reports are generated quarterly. Add PEPR retrieval to your compliance calendar so that it's always on everyone's radar. Number three, review and respond. Review and analyze the reports with your revenue cycle and your compliance teams. Provide necessary training to all team members in order to understand critical compliance items. Understand organization-specific claims and reimbursement drivers. And if you need more clarity on benchmarks and comparisons, ask your business advisors. Update related risk mitigation and risk response strategy. And if you're not clear on how to respond, Berry Dunn's Compliance Group is ready to help. And lastly, share findings. Share those critical report findings and any related action steps with your board, quality improvement, and other relevant departments.
Now let's take a moment to answer some questions that Berry Dunn's clients ask us frequently. My first question is for Cheryl. Cheryl, what if provider is at high risk for overpayments?
Well, thanks for asking, Olga. PEPR reports look back the previous 12 federal fiscal quarters for improper payments. And that can put the provider at risk for fines, disqualification from billings, and a myriad of other issues for both the provider and the facility. So we can help the provider and organization build best practices to build quality fiscal stewardship, patient satisfaction, and safety outcomes. We look at things like the annual reimbursement that might be at risk, the volume of claims at risk, the external review focus, likelihood of risk, and what controls you have in place. So Berry Dunn can also help providers and facilities create both an action plan and regulatory remediation action steps.
That's very helpful to know. Thank you. Our next question is for Denny. We noticed our organization was trending lower than expected. What does it mean for us? What should we do?
That's another great question, Olga. And the Pepper report just tell you where you are to your peers. And the real question is why? So the first thing you have to do is really understand the why. Why are you trending above, below, or even why are you staying at the median, right? Maybe your organization should be higher based on the patients that you serve. So it's very important to look at a wider breadth of available benchmarking data, which Barry Dunn has available, and can kind of help you see a bigger picture of where you're standing compared to your peers on many other metrics. But one thing that we believe is very strongly is you have to do a deep dive revenue cycle assessment, at least every couple of years, if not annually. And this allows you to really understand your operations, understand your charge capture and coding, understand what's being submitted on your claims, and understanding if you really do have an opportunity to improve your charge capture, coding, and documentation, or if you do have a risk across your organization. So you really have to, I guess, to answer this question, understand the why behind it. And in my opinion, looking at other benchmarks and doing a deep dive assessment is the best way to get to that why.
So let's talk a little more about benchmarks. My next question is for Rachel. How can organizations get better, deeper understanding of how they compare to peers and define peer group for themselves instead of what's already provided on Pepper?
So here at Barry Dunn, we have an extensive database that comes from multiple sources, including the Medicare cost report, as well as internal information from our client base. We can help your organization understand how you compare to your peers based on your geographical area, nonprofit, for-profit, or any other similar grouping. To be able to do that, you want to connect with our home health and hospice group using the Barry Dunn website to find out more.
And just to add to that our hospital group and senior living group also maintain extensive benchmarks and using different sources of information. So to summarize, we hope that this short video was helpful to you and your team. And we ask you to visit our website to download Pepper checklist. You can see the link on the slide. And please do not hesitate to reach out to any one of us with any questions you may have about working with Pepper, about your revenue cycle optimization, compliance, and benchmarking. Thank you, and see you next time.